So, I mean, young people who have obesity, but they don't not diagnosed with any diabetes, they come to you. What, do you- I mean, how you talk to their family? I mean,
About weight management, yeah.
yeah.
So we look at the kind of things that they're eating at the moment, their lifestyle, and how food fits into their day. So quite often you might see a quite unstructured process to food and to eating, where people can graze, go to the fridge, and have a fridge stocked full of things that are perhaps not as healthy as they could be.
Yeah.
Actually, by organising a meal pattern and getting them to understand how to build a healthy plate is one of the first things I do. So looking at the balance of nutrients, about half the plate filled with vegetables, a quarter filled with protein, and a quarter filled with carbohydrates. It's a really good model for somebody who needs to reduce their weight.
So back now to the point that the prevalence of type 1 diabetes, it's among children and young people in England and Wales. The increase, there is significant regional disparity. What do you meaning by the regional disparity? I mean,
It means that more people in that area have that condition, and it's unclear why that might be, but it might actually go back to the type of people that are living there who have a genetic disposition to that. The other thing we've got to think about is actually the disparity in care, which means that actually some people in more deprived areas are not getting the same level of care as people in those that live in more affluent areas, and that's something we really need to address.
so I mean, now you said that the percentage is 27. It is an increase.
I think it is an increase in general, yeah. So there's more people now that have diabetes than there was previously. We also have an increase in population though, so I haven't seen the data, but I'm not sure whether that's an actual increase in real terms or not.
Do you think that's something really to worry about?
It is something to worry about, particularly if we can't get the care right. So if people are not receiving the care that they need to manage their diabetes well, then we're going to be seeing more things like kidney disease and eye problems, blindness, and other peripheral nerve damage as well. So because of the risk factors that you get with diabetes, actually these long-term chronic conditions which are really putting pressure on our NHS and actually to people's well-being later on in life. So it is a problem, we definitely need to address it.
So let's stay away from the genetic dispositions. I mean, what's went wrong and this very small children get this
So
disease?
diabetes is an autoimmune condition, and we're not quite sure what causes it, but people with a genetic disposition have a greater chance of getting it. So if you have diabetes in your family, then you are more likely to get diabetes yourself. Okay, but it's unclear what triggers the disease to happen. But what happens is the immune cells start to attack the pancreas, and the pancreas can't produce insulin anymore. And that's why insulin replacement with a pen injection is the main treatment for diabetes.
So do you have any campaign that and go and knock the door of the parent and say obesity is something you have to be worried about, and this obesity is really ring the bells of danger that your kids maybe get diabetes?
So there's two types of diabetes, and type 1 diabetes is independent of obesity, so it happens whether you're obese or not. But then there's another type of diabetes, type 2, which is very dependent on obesity. Your risk for getting type 2 diabetes goes up significantly if you are overweight. So yes, it is a really, really big problem. And normally, type 2 diabetes used to be called late onset diabetes because it didn't used to happen until people were sort of in their 40s and 50s. Now we're seeing a much greater incidence of it happening, of teenage children, children over the age of 12. So it is definitely something we really need to concentrate on.
Finally, do you have any difficulties of treating young men for having diabetes? I mean, what the reaction of their families?
It is quite a complex thing to cope with. You have to measure your blood glucose levels, you have to incorporate all of the different advice you get given, and it is quite a kind of complex thing to manage. So it can be quite a difficult thing for people to manage, and I think that's one of the things that we need to incorporate more into our diabetes care is actually the psychological support that people need when dealing with it. Also things like structured education programs for groups of children so that they can support each other is a really good way, and it's been shown to be effective in managing adult diabetes as well.